Treatments can start with initiating a broad-spectrum antibiotic, an antibiotic that acts against a wide range of disease-causing bacteria. These medications are used when a bacterial infection is suspected, but the group of bacteria is unknown, or when there is an infection with multiple groups of bacteria. It is good to remember to get blood cultures before administration of antibiotics. A narrow spectrum is effective against only a limited range of organisms, which is why they are not commonly used in the initial therapy. Vasopressors is a drug that causes constriction of the blood vessels and are used for persistent hypotension. An example of this is Levophed, also known as norepinephrine, is a non-selective alpha agonist and it works the opposite of a beta blocker. When reduced to intubating a patient, a sedative like propofol is used to decrease the level of consciousness, and succinylcholine is a muscle relaxer used to assist with mechanically ventilating a patient. To increase tissue perfusion, dobutamine, an inotropic beta agonist used to increase the force of contraction to the heart muscles, is used in treatments of heart failure or cardiogenic shock. Its primary mechanism is direct stimulation of B1 receptors of the sympathetic nervous system. Severe acidosis causes decrease in both blood pressure and cardiac output as a result of decreased myocardial contractility. Lactic acidosis may develop in patients owing to inadequate delivery of oxygen to tissues to meet metabolic demand. The most common therapy is administration of bicarbonates. Albumin is used to draw fluids into the vasculature. Thrombocytopenia is a symptom of severe sepsis, organ failure, and fresh frozen plasma is a good way to increase platelets. If the kidneys start to fail, they will be unable to excrete most of the toxins in the blood. They will then require temporary hemodialysis. If a patient is hypotensive, hemodialysis may even further decrease their blood pressure. Take the necessary precautions. DVT prophylaxis is used for patients who are immobile, for example, those who are intubated. These are some pictures of wounds due to decreased perfusion to the extremity even after fluid resuscitation has been given and vasopressors administered. For this specific patient, antibiotics were given too late. If they were given in a timely manner, this could have been prevented. In the end, both her arms and legs were amputated. According to the Sepsis Alliance, there is an average of 38 amputations a day resulting from sepsis. Nursing interventions. Nurses have one of the most important roles of the interdisciplinary team due to patient contact. We are the ones who assess and reassess. We are the first to notice any changes, and therefore, knowledge of the signs and symptoms of sepsis is highly crucial for all nurses. Nurse should assess vital signs, neurological status, labs, patient history, medication schedule, patient Foley insertion time, IV insertion time, IV tubing hang time, and surgical wounds. Nurses should also assess patient knowledge on signs of infection, hand hygiene, and surgical wound care. Notifying charge nurse of SIRS criteria for a sepsis alert is a very important part of nursing interventions. Assess for dehydration. Check cap refill, skin tuger, mucous membranes, and heart rate. Assess perfusion. Check pulses, cap refill, color of skin, and extremity temperature. Inserting Foley catheter will help to monitor strict eyes and nose. We are assessing lung sounds for crackles to monitor patient for overhydration. Look at all the trends from all data collected. Get 2 blood pressure readings within the hour after the 30 milliliters fluid bolus. Why is it important to know your patient? You can't always assume that your patient is septic without looking at the whole picture. Ask yourself, what meds are they on? Are the symptoms side effects of the medications? Know your patient's history, baseline, allergies, and have a full grasp of your patient's diagnosis. Pay attention to the trends in vital signs and labs. These trends are much more than just a set of numbers. These numbers allow you to determine body function. Keep in mind that just because a patient looks stable for now, it doesn't mean they will remain stable. Vital signs and lab values can spiral downward fast. Reasons why it's imperative to reassess. Also know when you're assessing your patient, make sure to perform a thorough assessment. Ask yourself, does my patient have an IV site? How does the IV site look? Are there any skin issues? What is my patient's mental status? How alert and oriented are they compared to the previous shift's assessment? In addition, give a thorough SBAR report so that time can be spent assessing your patient at the bedside instead of having to look through the patient's chart. If sepsis is suspected, know that treatments are required and what is your facility's protocols.
Identifying sepsis can be a challenge. Certain medications and conditions can mimic or mask sepsis, making it difficult to identify. For example, medications like beta blockers decrease heart rate and therefore can mask or neutralize the Sears criteria of having a heart rate over 90. Vasopressors can mask hypotension. Patients with severe burns can be in a hypermetabolic state. This condition results in a patient displaying signs of tachycardia, tachypnea, and hyperthermia. These three signs meet Sears criteria, but is not sepsis. While it is a good idea to keep sepsis in the back of your mind, take a look at the whole picture. Do not assume a patient is septic simply because he or she meets Sears criteria. First, ask yourself if that patient has a known or suspected infection. Next, determine if there has been a sudden change in mental status and vital signs from baseline assessment. Then, determine if the vital signs are related to any medications given, environment, situation, or any health diagnosis. Here is a list of some helpful education topics to bring awareness to sepsis prevention. Educate patients about the fact that sepsis can mimic signs and symptoms of the flu. Let patients know that antibiotics have no effect on flu-like symptoms in order to decrease antibiotic resistance. If a patient is prescribed antibiotics, educate that patient on the importance of completing the full course of treatment to lessen the likelihood of antibiotic resistance. For patients with increased risk for infection, educate them on the signs and symptoms of sepsis and to call 911 if needed so that there is no delay in treatment, as time is of the essence. Educate about the importance of vaccinations to prevent infections and illnesses that can be avoided. Lastly, let patients know that there are support groups and help available for both family and patients afflicted with sepsis. Life after sepsis can be difficult both mentally and physically. Patients can be dealing with many emotions ranging from sadness, anger, and frustration. Some patients face amputation of the extremities due to the lack of perfusion, which causes them to have a longer road to recovery through rehabilitation. Other patients can have a hard time coping with life after sepsis due to decreased health. These patients now have to find a new way to live with their current health, which can be distressing to many. As nurses, it's important to contact social services for these patients in order to make sure that these individuals have all the necessary tools and services to reach their full potential to health. To sum up the presentation, remember these key points. If you act fast, you can get ahead of sepsis. Be aware of your facility's sepsis protocol so that you can recognize the first signs of sepsis and take the necessary actions. Obtain a thorough SBAR report so that you fully understand what is going on with a patient and so that time spent at the bedside is not lost. Be a patient advocate. If you feel like something is wrong with your patient after all assessments have been done, and if you feel like your patient is deteriorating fast, trust your instinct and call a rapid if necessary. It can save that patient's life. For more information about sepsis, please visit these websites. These websites provide additional information about what sepsis is, prevention, treatment, life after sepsis, and more. For mental health support, please visit sepsis.org or call the National Suicide Prevention Lifeline. Remember, if you feel sick, always visit your doctor.